Recovery Act, which again provided key help to states to avoid cuts to their Medicaid programs in this very difficult economic time. Now, thanks to that swift action, we know that in that intervening period, 2.5 million additional children have been enrolled in Medicaid and CHIP during 2008. Today, in the midst of one of the deepest economic downturns this country has ever seen, certainly since the Great Depression, the share of children without health insurance in America is lower than it's ever been before. And that's very good news, that children don't bear the brunt of this economic downturn. But our work has only begun. As the Urban Institute report that's being released today confirms, there's still 5 million children, we think, across the country who don't have health insurance, even though they are currently eligible for CHIP or Medicaid. There are kids like Henry, who I met last week, whose family lost their health insurance coverage when Henry's mom got sick and ultimately died from cancer. She had the family coverage, so when she had to give up her job, the family lost that coverage. Their parents, like Heather and Henry's dad, Gary, both who had good jobs, but they went without coverage for years because the cost was just too high. Now, maybe there are families like theirs who didn't know they were eligible for programs, or they didn't know how to enroll. Maybe they had applied in earlier days before the program was expanded or before the state changed criteria, and they were turned away. But this is the United States of America. Those rules are changing all the time, and what we firmly believe is no child should go without health insurance. So last February, we issued a challenge to my state and federal counterparts, to local governments, to community-based organizations, to health centers and school districts, to faith-based groups and the provider community and Indian tribes. Find and enroll these children and help us reach out to the 5 million unenrolled kids over the next 5 years. Groups from every sector and level of government have come forward. Healthcare organizations, faith-based organizations, philanthropic groups, and the blogosphere. We now have 16 new national partners, many of whom are represented here today. And I want to take a moment to recognize the 16 national organizations that are with us. So please stand so the audience can see who you are. Can our 16 partners who are represented here today stand up, please? Thank you all. And as Cindy said, you're going to have a chance to hear from a number of them